you know, we had a big problem with cancer, as we all know, and treatment. We have again upped resources for cancer from 500,000 to now 800,000 cover for all citizens registered under SHA. So that is the trajectory. I don't know, Mercy, whether, again, I have answered your question.
Yes, Mr. President, but I don't want to be accused of inviting you to a town hall of this magnitude and asking all the questions. I think we should let the Kenyans here also ask some questions, and I'll hold mine for later so that we can field questions from the room, if you allow that. So you can pick.
Okay. So I'm the one to pick the, I thought you were going to do that for me. Okay, I see some beautiful lady there. Madam, you have the floor.
So, good evening, Mr. President. My name is Lois. I'm a person with albinism, and I stand here to speak for persons with albinism and persons with vitiligo. For us, sunscreen lotion is an essential. It's not for cosmetic purposes, and mostly it's not covered using the social insurance cover. So, whom do we go to, or what approach do we take for us to make sure that we have it, since most of the times the government provides it, but it is not enough, and at times it's not there at the hospitals. So how do we go to, where do we go to, or how can we go about it?
Very good, thank you very much. Did you say, what's your name?
My name is Lois.
Lois.
Yes.
Lois needs an answer. Yeah? Lois needs an answer.
Thank you. Thank you, Lois, for that question. Your Excellency, vitiligo, I'm not a dermatologist, but I'm a doctor. And vitiligo is a condition where the cells that are called melanocytes in your body are not able to produce the needed melanin. Now, the problem with patients who suffer from vitiligo is that they're exposed to the sun, and because of that exposure to the sun, they're at risk of getting cancer. And so actually we need to protect patients who have vitiligo by ensuring that they have sunscreen, they have the necessary steroids, and they also have UV light therapies. The madam is correct. In terms of our current benefit package, what we have in offer as government is that KEMSA, and I hope Dr. Wako is in the room, do procure sunscreen at subsidized rates to be able to ensure that those who have vitiligo can access that sunscreen. However, at SHA, we have not yet started reimbursing for sunscreen, so you won't be able to get it from SHA reimbursements. Your Excellency, the case of vitiligo accompanies many other cases when it comes to healthcare. And what is important for our country is to start on a journey of progression. As we start here today, we are covering a large burden of disease, the things that cause the most harm. We are by no means saying we cover everything, but there is a scientific process of being able to determine how we add more benefits into our package to be able to cover everyone. And that's the journey of UHC that all countries must go through. So the short answer right now, Your Excellency, is that when Madam needs care, she'll be able to go to a PHC center. But unfortunately, what she needs in terms of sunscreen and some antisteroids are not yet available in the package, but will be available as we continue mobilizing more resources.
So what do we tell Lois? Do we tell Lois
coming soon?
How much time do we need? And Lois, I agree with you. We have a huge benefit package. And I remember I sat down with my team and we said, we need to look at a benefit package that we can afford. Let me tell you, Lois, today we are paying 2.75% of our income. We should know that countries that provide universal health coverage pay up to 15%. Go to any country. It is not 2.75%. It is 15% for them to provide the full package. We have started with the package that we have. But I think, to be fair to people living with disability and others who have conditions like the one Lois has said, including vitiligo and all the others, I think it is time that we come back to Lois and tell her at what point will we include the sunscreen she is looking for. And I want to tell you this, Lois. It is homework you have given to me. Let me take it home.
And Your Excellency,
I will have an answer for you and for all the others who are like yourself.
And Your Excellency, just to add, you've actually commissioned the Ministry of Health to review the benefit package, and you've given us a deadline of ending October. So all Kenyans are invited. We'll be having public participation on the new benefit package for SHA, and we'll be looking for Lois and all other members who want more benefits to be included. And we'll give the reports on the new benefit package at the end of October.
Thank you very much. In our midst, I want to listen to a manager of a facility. I have said here that facilities, I want somebody who runs a health center or a dispensary.
Mr. President, we have one on standby at Ruto. If we have that link ready, yeah, we have Alice Ndwiga at Ruto Health Center. But as we get her ready, maybe we can pick one from the room.
Do we have a manager?
Here she goes. This is Alice Ndwiga.
Okay.
County.
Alice Sabari.
Good evening.
Good evening, Alice. How are you?
I'm very well.
Habari ya Ruto?
Ruto iko baridi mingi, but tuko salama.
Very good. Tell me, Alice.
Yes, please.
Before UHC, is there a difference between are you a manager of that facility? Or
Yes, I am. Maybe I can introduce myself, His Excellency. My name is Alice Ndwiga, Facility Manager at Ruto Hospital, Level 4.
Yes.
We are here at Dagoretti Sub-County,
Okay.
the North
Okay.
Kangwari Ward.
Let me ask you, Alice. What is your experience as a manager? The journey over the last 3 years. What is your experience? How has your facility improved? What difference has universal health care, SHA, made in your facility?
Okay. Thank you, His Excellency. So to just begin, here at Ruto Hospital, we do have a good expansion of services, and that's all in contributions that we've had from the SHA reimbursement and also the expansions on the PHC services that we have. In addition to that, we started with 200,000 that we were getting in a year with the NHIF, but now with SHA, we have between 5.5 to about 6 million that we've been able to have an increase when it comes to SHA. In addition to that, we've been able to do a lot of expansion of services, like I'd mentioned. We'll be able to have the services where we were able to have before the TB on the outpatient and also the NCDs as well. So in addition to that, we were able to have addition on the theaters that we also have, the NBU that we're also able to manage to have our bed capacity that is about 10. And the most importantly is our workload that we're able to have our increase of our patients from 200 to now 400 patients per day.
So you're telling me that you used to get reimbursements of around 200,000. Is that correct?
Yes, His Excellency.
Per month?
Yes, His Excellency.
What is your reimbursement now from SHA every month, on average?
From SHA, we about between 5.5 to 6 million a month.
So it's gone up.
It's gone quadruple up.
how are you deploying that money that you get in your facility? For what are you using that money?
Okay, so for one, we have been able to expand our services. That means from our end, we were able to have our lab machines that we were able to buy too for the full hemogram and also the biochemistry machine as well. And that has expanded our services when it comes to Ruto service. Then number two, we've been able to do the theater. We've been able to expand our services on our end, and also the NBU that we're able to expand to 10-bed capacity. So for Ruto Hospital, the reimbursement that we've been able to get for SHA, it has been able to expand our services and also be able to have our areas where, when it comes to not only equipments that we're able to get from the SHA reimbursement, we are also able to get the gaps that we're able to have into the service delivery here in Ruto Hospital.
So, Ruto is it a dispensary or a health center?
It's a health center.
So when I made a commitment,
but with the addition of...
Yes, sorry, please continue.
Sorry, with the addition of the services that we'll be able to have, the hospital will be able to move from the health center level 3 that is in now to a level 4 that is going to be comprehensive of all the services.
So my question to you, Alice, is that...
Yes, His Excellency.
I did make a commitment to you and to facilities like yourself that we are going to have a system that will improve service at that level, at level 2 and level 3. Can you confirm that that has actually happened?
Yes, I can definitely confirm. So, for example, right now, the theater machines that we're getting installed here for the theater and also for the NBU, they're actually coming from the NESP. That's the National Equipment Service Program that we are very glad, His Excellency, to be able to support the facilities when it comes to equipping the hospitals. And also with the contribution from the FIF that we're also getting in the hospitals, we're able to also expand the services and the equipments that are needed. And also to get the medication, Your Excellency, I can be very proud and actually say with a lot of confidence that I don't miss drugs here in Ruto. I don't miss that's non-pharmaceuticals and lab reagents. So those are the 3 areas that I make sure that when we are doing our reimbursement that is coming from SHA, our FIF that we get from the hospital, we make sure that it's getting back to the patients and also the community at large. Then to also mention, we do make very good food, His Excellency, for our patients.
Thank you very much, Alice.
Our maternity.
I want, thank you very much, Alice, and my very best wishes as you provide service to Kenyans there, and good luck with what you're doing, and congratulations. Thank you very much. We're really proud of what you're doing
Thank you for this.
In Ruto. I want somebody live here who is a manager of a facility to be able to tell us here, you know, do we have a manager of a facility? Yes. Are you a manager of a facility?
I'm the County Director of Medical Services.
Proceed.
Yes, my name is Dr. Eliza Ikiara. I wanted to highlight some of our facilities, how they're doing before SHA. For example, Ugweri Dispensary, one of our, in Embu County, Ugweri Dispensary, which is a level 2. With NHIF, they never used to get anything, 0. But with SHA, with the PHC, they are getting around 6.4 million in a year. And also we have Gategi, that's a health center, Gategi in Mwea sub-county, which gets around 9.6 million now in a year. And the other one that we have is Kianjokoma, which is a health center in Runyenje sub-county, which has around now 10 million. And with that, they are able to procure medication, lab commodities, and non-pharmaceuticals for themselves, and don't have stockouts anymore that we used to experience before. And also, they are able to also, for example, Gweri was able to install CCTV cameras in the dispensary.
What do you have to tell to the people who say SHA is not working?
And for me, I would say for us in Embu County, we have seen the difference. We are getting, our revenue has increased exponentially. We are not running out of drugs. We have refill rates of 80% and above. and even Embu County scored highly in our pharmaceutical dispensing rate that was done by, we had 72%, meaning 72% of the clients get the whole prescription filled at the facility.
Do we have, thank you very much, Daktari. Do we have a facility manager? I want somebody who runs, do we have somebody here? I really want somebody who runs. Do you run a health center? Yes, please give her the mic. Tell us your experience.
Thank you, Excellency.
Your name first.
My name is Gladys Chebet. I'm the facility in charge, Ngaira, which is just across here.
In Nairobi?
Yes.
Okay.
Just here at Technical University.
Okay.
Yes.
Proceed. What is your experience of the difference? Has SHA made any difference in your facility?
Yes, yes. Before SHA, we actually used to get some funds from Danida, which was around 270 to 50,000, which actually never used to cover everything. But right now, I've been able to claim over 7 million. And we've been able to procure a full hemogram machine. Our laboratory is working optimally, yeah. And our pharmacy is full. In Gaira, we are running a NCD clinic, which has around 1,600 clients. And they are all going home with very good drugs. And SHA in our work, yes.
In short, SHA in our work.
Yes.
Okay.
And sorry, we have been able to improve our infrastructure. Yes. It used to be a very old facility, but right now, it's good.
Very good. Thank you very much. Do we have another person who runs a health facility? Do we have a person who runs a health facility? No. Okay. Let me go to the second item. You know, KEMSA, I have said here that KEMSA has increased the refill rate. I made a statement earlier. And Wako, the CEO of KEMSA, is here. We have taken refill rate for requests from hospitals from 40%, meaning that if a facility requested for 10 drugs, we could only provide 4. We've moved that to 91%. And among the best performing counties, and we must give credit where it's due, is Kilifi County. The governor of Kilifi is here, Governor Gideon Mungaro. Mr. Mungaro, Governor, can you tell us ama utueleze kwa lugha ya Kiswahili mambo vile yalivyo?
Thank you, Excellency. When I took over in 2022, August, the first few orders, first we had a very big bill of 429 million inherited. We negotiated with KEMSA, but for the first 1 year and a half year, we were getting between 38 to 40 of our orders. But I remember after our last summit when you promised, because as a county we have really tried to buy from KEMSA, because we have two advantages, Your Excellency. Apart from when we started, we had only 38 to 40%, but one thing you can be sure, the drugs you buy from outside KEMSA, 10 million you buy from KEMSA, you spend maybe 30, 40 from other entities. So since 2025 coming 2024, towards the end of 2024, it started going up. The last two orders we did to KEMSA, we got 183%, and the last one we did a few months ago, we got 70%. Probably we tell Wako where he needs to improve is on surgical gloves, which we always have a challenge sometimes, and the other gloves, I don't know if the doctors call them what? Sterilite. Because sometimes you go, they are there, but you get number 7, and some doctors are very big hands, you need number 8. So maybe that's where we need some improvement. But I must say, since I came to office, Your Excellency, I bought drugs 1.6. I bought from outside before when we got only 38 to 40. But I have bought from KEMSA, and the worker will testify that I bought as a county drugs worth 1.6 billion and 80 from
Thank
KEMSA.
you very much.
Thank you.
Gideon Mungaro and I are not doctors, so forgive us if we don't know some of the names of the gloves and all that.
My CC, Your Excellency, can talk something. I know you wanted only facility managers.
Yes.
But my facility manager will return from the gate because they said they know him.
Okay.
But he can tell you something about KICC Hospital.
Okay.
Because it is completely a change when we started doing SHA.
Yes, Your Excellency, I can confirm here that there's been quite a transformation since we started receiving the SHA reimbursement. We have been able to expand our hospitals with equipment from 2 theaters. Now our referral hospital, we are operating 5 theaters, which means patients don't have to wait for a very long time. Another hospital, we started with 1 theater, now we have 2 theaters. And in the 3rd hospital, we now have 4 theaters. And all this equipment we're buying based on the reimbursement we're getting from SHA. So there's a lot of transformation. And as far as the procurement of drugs is concerned, through KEMSA, Your Excellency, we've seen tremendous improvement. From the 40% which we started with to now we're getting 83% of our orders. And even with that 83%, we still get back orders to fill the difference, which we still distribute to our health facilities. And for the SHA reimbursement at our primary care facilities, that has really improved our drug availability because they are able to spend at source to procure the higher support staff with the money, and therefore we've really improved services using SHA. Thank you.
Let me ask you, are you a doctor?
I'm not a doctor.
You are a manager?
Manager, yes.
Let me ask you, before we did not have the law on Facility Improvement Financing Act. What difference has it made? Because under NHIF, money was being sent to the county. Then it was up to the county to decide which facility to go improve, which facility not to go improve, which facility to buy medicine for, and which facility not to buy. Today, every facility is reimbursed their money. Is that the case?
Your Excellency.
And how has that helped in making sure that there is delivery of service?
Your Excellency, the implementation of the FIF Act has tremendously improved. First of all, the fact that the facilities themselves are able to spend the money at source is an incentive for them to make sure that they generate more. Therefore, they contribute to recruitment of members to SHA so that they can be able to have more resources to spend. But more importantly is the fact that they are able to make the decisions based on the priority of the hospital at that moment. They don't have to consult elsewhere or wait for resources from the county treasury to make funds available at the facility. They are able to prioritize and act on the spot as they receive the reimbursement from SHA. Thank you.
Very good. I want to ask one more question to either a CZ of health
Your Excellency, I wanted to add from where the CC, he didn't elaborate something. The Kilifi Referral Hospital, we used to collect about 1.7 million a month. And now we are 30 million. Malindi used to collect 1 million. Now we are 16.5 a month. So that is the change I thought the CC will explain.
And that is the money, Gideon, you are using to improve the facility.
Yes, we pay even locum nurses. from that money.
Yes, you pay some of your staff.
Yeah, and all the casuals who work in the hospital or contractual workers.
And also to improve the
Infrastructure,
theaters
yes, yes.
And all the other facilities.
Like the 5 theaters he was talking about, we just did them. They are 3 weeks old.
Using money reimbursement from SHA.
Generally, when we took over the county, the hospitals, the level 4 hospitals and the Kilifi referral were collecting in total 176 million in 2023, June. Now we have collected 900 this year, 900 million from 176.
Okay. Let me ask one more, KICC, because it's good for us to listen from practitioners on the ground, not people who are talking from political podia. Do we have? I want to ask a question, and I want KICC to answer me. Is it correct for me to say, just as I committed to the people of Kenya, that today dispensaries, health centers are more empowered to make decisions on how to use that money, which drugs to pay for, which theater to improve, what facility to improve in every facility? Is that the case, or they have to wait for a county to decide or for somebody else to decide? Are you a facility manager? You are a KICC. Please tell us your name, and please help this audience and others listening to understand.
Yes, my name is Dr. Gregory Ganda. I'm the CECM in Kisumu for medical services. It is true that with the FIF Act, now facilities can make their own decisions. But it is even better because the facility board is made up of members from the same community. So they oversight these funds. So whatever the facility decides, the technical people make decisions, and then they get the oversight of the community. So the decisions about that funding and how that funding is spent is both technical, but also involves the community. So I can confirm that, yes, this is true.
So, and I remember giving an analogy that the same way you have a school management board helping us to manage our schools, to build classrooms, and to make sure that the facilities are there. Today, our boards, which are members of the community, they are the ones who oversee the money we reimburse these facilities. They are the ones to decide that we want to make sure that there are enough health commodities. That is medicines and all the other things. We need to repair, we need to buy this equipment. We need to buy the other equipment. That is the case, Daktari, is it?
Yes, that is the case. We allow them to make decisions, but of course we oversight them sometimes. Like for most facilities right now, in most counties have given a minimum, because sometimes they might decide, members of the community can say, build the gate and build the wall and all that, and then you don't have enough medicine. So we are giving them a minimum percentage. Most of us are doing 40, 50%. Half the money must buy medicine, because the biggest problem of Mwananchi is hakuna dawa. So we don't want anybody to come here and say hakuna dawa. Once that is sorted out, maybe you can paint, you can do other things.
Very good.
Thank you.
I want to ask one more question. Just sit down, Daktari.
Thank you.
Because, we need to answer to the things that Kenyans want to hear. Number one, we said we are going to empower every facility to make decisions. We send the money, not anymore to the county, but we send reimbursement for every citizen a dispensary treats. For every citizen a health center treats. We send the reimbursement to that dispensary. If they treat 20 people, we send reimbursement for 20 people. If they treat 1,000 people, we send reimbursement for 1,000 people. But financing is not the only challenge. The other challenge is equipment. to be able to provide service, you need the theater, but you also need equipment. And this is what we did. And I want CECs who are here to confirm, and even our friends, the governors who are here to confirm. We did the following. We said that it is not possible for some of our facilities to buy an MRI machine, to buy a CT scan machine, theater machines, IC, whatever. Many of these facilities are expensive. They are in hundreds of millions, tens of millions, some of them in hundreds of millions. And so we agreed and we designed a program called National Equipment Service Program. Yeah? And how did we do it? We said, let us pool all our facilities and negotiate together with manufacturers. Because it is difficult for manufacturers to go and negotiate with a dispensary or a health center alone. But if we pool together, through the economies of scale, we can be able to have the muscle to negotiate for better prices, better facilities, and also for the manufacturers. It is easier for the manufacturers to deal with us as one entity than to deal with us as individuals. They are assured of their money being paid, and they are assured that every facility is going to pay the rate. So, today we have equipment supplied by manufacturers, equipment that has not been paid by the facilities. In the past, under the MES program, Managed Equipment Service Program, we paid almost 63 billion for equipment, some of which did not work, some of which broke down and there was no service, some of which we did not even have the reagents and consumables, and it was very problematic. So we thought and said, let's do it differently. I want to know from either a manager of a facility or a CEC, what is their experience? How many equipments have they got? And what is their experience with the equipment that is being supplied under this framework? Do we have a manager of a facility or a CEC? I think I have some gentleman there. The gentleman in some brown, nice suit.
Asante Mheshimiwa Rais. Jina langu ni Daktari Martin Wafula, Mutuini Hospital. Kwa kweli ule mpango wa kuleta vyumba kazi kwenye facility zetu imetusaidia sana. Kwa sababu ya kwanza, hatujalipa hela yoyote ili tuletewe machine za upasuaji kwenye hospitali zetu. Kwa miaka ambayo nimekuwa hapa karibu nikifanya kwenye mahospitali kadha wa kadha, kutengeneza theater unahitaji pesa ya chini kabisa ni milioni 50 ili uweke theater ambayo ina vyumba kazi, ina mashine ya kutosha na pia ina instruments. Lakini kupitia huu mfumo wa NESP, facility zetu kwanza ya kwangu ambayo niko namalizia, nimepewa theater 3. Na hizi theater 3 zinakuja na mashine ya kupeana anesthesia. Pia inakuja na mashine ya upasuaji ya kitanda. Pia inakuja na mashine ya kupeana mionzi, radiotherapies na x-rays. Manake hivi vitu baadhi yetu, Mheshimiwa Rais, baadhi yetu na ndugu zetu ambao wamekuwa kwenye vyuo vikuu wakisomea taaluma ya udaktari hawakuwa wameviona, ndio mara ya kwanza wanaviona kwenye hospitali zetu. Jambo la tatu, kuna baadhi ya mashine, kwa mfano endoscopy, Mheshimiwa Rais, mpango wa endoscopy, wa colonoscopy, hizo surgeries ambazo haupasui mtu, unatoboa kashimo tu, alafu unapasua mgonjwa, baada ya siku chache ameenda nyumbani. Hiyo ni heko na ni kitu ambacho lazima tujivunie. Jambo la 4 ambalo mkurugenzi wa DHA aliliongelea, Mheshimiwa Rais, kwa mara ya kwanza kwenye hii nchi ya Kenya tuna mfumo, na mwenye anataka kujua aje Mtwini kesho ama aende hapo sasa hivi, mgonjwa anaonekana akiwa wapi? Nyumbani. Na hili limefanya tukapunguza idadi ya kupoteza wamama. Kwa mwaka mmoja miezi mitatu, Mtwini hospitali haijapoteza mama hata mmoja. Kwa sababu gani? Tunatumia telemedicine platform. Aidha, Mheshimiwa Rais, haya magonjwa endelevu, non-communicable diseases, haya magonjwa yamekuwa tondazugu zaidi, na jambo ambalo linatuzuia, tunao madaktari bingwa wachache. Kwa mfano, unaweza kuwa tuna daktari bingwa wa upasuaji wa ubongo mmoja ama wawili, lakini kutumia mfumo wa telemedicine ambao DHA imetupa, tunaweza ona mgonjwa mahali popote pale na ule daktari apeane mwongozo. La mwisho kwenye teknolojia ambao pia imekuja na SHA. Mheshimiwa Rais, tulikuwa na kitu inaitwa rejection rate ya claims, lakini kwa sasa tunaongea hivi, rejection rate yetu sasa hivi is less than 1%.
Pale Mtwini na pia kwenye mahospitali mengine ambayo ndugu zangu wako hapa, ukienda Mama Lucy, ukienda Mbagathi, ukienda Pumwani, hivyo ndivyo hali ilivyo. Thank you very much. Nimesikia kwa mara ya kwanza daktari bingwa. Utanieleza hapo nyuma ya ndio ni kusema aje? Sawa sawa, daktari bingwa. Let me ask, can I get let me ask one of the manufacturers, supplier. Can we have a supplier of theater equipment? Because that is what my brother there. Do we have a supplier here in this?
I can see a hand up there.
Do you have a supplier? One of the suppliers?
A supplier?
Are you a supplier? No. Are you a supplier?
No.
If you are not a supplier, please, let's be tuwe na heshima. So let's pick what first, because we want to know from our suppliers. Was any supplier invited to this facility? No supplier was invited. Because I wanted to know the numbers. Do you have the numbers of how many theaters, how many have been supplied in the country?
Yes,
how many?
Yes, Your
the
Excellency.
number of equipment, the number of
Yes, Your Excellency. Under the National Equipment Service Program, we have supplied 52 digital X-rays. Your Excellency, we have installed 72 ultrasounds. We have installed 6 mammograms. We have installed 39 CT scans. Your Excellency, we have renovated and equipped 67 theaters. Your Excellency, we have established 157 laboratories. That alone, Your Excellency, worth more than 2.3 billion. Your Excellency, as the CEO of Mtwini was speaking, he mentioned specialized surgery. So specialized urology, as we know, prostate cancer is one of the big 5 cancers. We have installed 4 specialized urology theaters. There's something that they call a urology tower. Your Excellency, we have also been able to install 4 specialized ENT theaters. We've installed 4 specialized maxillofacial. We have also installed specialized cardiothoracic and vascular centers, 4 of them. Your Excellency, we have able to install specialized plastic centers 4. We have also been able to replace the Linac machine at Kenyatta National Hospital that used to break down often, Your Excellency. Kenyans know this story. Your Excellency, we have also been able to do 2 MRIs, and 2 MRIs are on the way by the end of this month. Your Excellency, in total, we've been able to install machines worth 9.8 billion shillings without the national government paying for it and without the county government paying for it. And Your Excellency, as you had mentioned, the game changer here is in the technology, the latest technology. And Your Excellency, one of the biggest challenges that we also have with equipment management is that the technology changes quite quickly, and most of our public hospitals are not able to employ what we call biomedical engineers to keep up with the latest technology. And so the game changer here is to keep equipment at 98% uptime without having to call manufacturers to come in and out to repair. Often, Your Excellency, the CT scans that were installed long time ago, 2 years down the line, they get broken down. You need another 16 million to repair them. You have to fly in an engineer from Japan or from Europe. And Your Excellency, you've been able to completely resolve that problem.
So, at the moment, under this program, we agreed that the equipment is placed by the manufacturer.
Yes, Your Excellency.
It is maintained and repaired by the manufacturer.
Yes, Your Excellency.
Consumables are provided for by the manufacturer.
Yes, Your Excellency.
All we pay for is for a service.
And when the service is offered?
When the service is offered.
And it is paid for by SHA?
If the service is not offered, we don't pay.
Yes, Your Excellency.
And it is paid for by SHA?
Yes, Your Excellency.
I don't know whether the CEO of Kenyatta is here.
He's in.
Yes. Kenyatta is possibly the largest public health facility we have in Kenya. Daktari Lesiambe, can you give us your experience as a manager of one of the largest facilities? How has your theater improved? How has service improved or not in Kenyatta? And then I want the CEO of Tenwek Hospital, one of the largest private health facilities in Kenya, to speak and tell us their experience. This is the largest public facility. We will also listen from the largest private facility. Yes, Richard.
Thank you very much, Your Excellency. Let me start by saying that Kenyatta National Hospital is the second largest hospital in Africa. I apologize by, correcting you, Your Excellency, because it is the second largest hospital in Africa. In terms of bed capacity, we are second to Chris Hani Hospital in South Africa. Now, Your Excellency, when it comes to management of health services in Kenyatta National Hospital and providing quality health care, we have to have equipment. And at Kenyatta National Hospital, as we speak today, we have 32 fully equipped theaters from 12 equipped theaters in the last 4 years.